Hello everyone, I am Dr. Anand Babu from Care Hospital Musheerbad, Orthopaedic surgeon. Today we just talk about the muscular pains and joint pains following COVID-19 infection. Now we are seeing quite commonly in COVID suffering patients as well as COVID recovered patients having muscle pains and joint pains. And most commonly knee joint is involved in most of the patients, and we also see the pain in the small joints of the hands and elbows commonly, and sometimes in the lower back. So most often what happens is because people are active before COVID and after COVID, because of the fatigue and all, they are not working like previous condition, so their muscles become inactive, and as patients age, because of the wear and tear of the discs in the lower back or the wear and tear in the joints, there will be some changes in the aged people. So once they become inactive and they are not doing their routine activities and daily exercise, so the muscles will become flabby and they become weak. So once the muscles become weak, the degenerated wear and tear prone joints like knee joints and the lower back, they manifest with lower back pain and the joint pains. And coming to muscle pains, the muscle pains are common because of the drop in the oxygen triggers some chemicals in the blood, so that there will be increase in the LDH and also increase in the lactate. So the rise in these chemicals will trigger pain in the muscles. This is because of the lack of oxygen. There will be anaerobic metabolism, and sometimes even drugs can cause symptoms like steroid usage can cause steroid myopathy, that is also weakness in the muscles following steroid usage. And sometimes people develop groin pain in the hip joint because of the changes in the blood supply to the ball and socket joint. The femoral head gets less blood, and thereby there will be pain in the hip joint. So coming to another less common feature which we encounter in all kinds of viral fevers like dengue, chikungunya, and some rare occasions in rare patients in COVID also we see reactive arthritis. In this form of reactive arthritis, there will be swelling of the affected joint, mostly the knee joint, and also there will be stiffness, morning stiffness in the affected joints. So this is commonly seen in reactive form of arthritis. So if you notice this kind of morning stiffness or swelling of the joints, involved joints, you should consult the doctor immediately and take appropriate medication and guidance from the qualified doctors. And because of the fatigue, the muscles like diaphragm muscle, which is responsible for taking respiration in the chest, and also other muscles are also get affected. So some patients they, after recovering from COVID, they want to resume normal activities as soon as possible. So when your body cannot cope with the exercise burden, you should not fast track your rehabilitation. You should go slowly. So when should you start your exercise as a routine? Probably after three weeks following the recovery from COVID, you should start slowly. Suppose if you are walking 5 kilometers previously before you had COVID, probably you start with 2 kilometers initially, but that too slowly, and keep monitoring your oxygen saturation, and keep monitoring whether the pain is increasing. Some pain increase in the pain in this common, but you can use some medications like paracetamol and diclofenac local sprays and gels, and local heat application, and sometimes over the counter analgesics like ibuprofen can solve the problem. And if the pain is severe, you have to consult a qualified doctor and take his advice. And when you are starting any exercises for the joints and muscles, you have to go slow, and you have to start with stretching exercises first, and when you finish the exercise also you have to finish with the stretching exercises. In between, you the exercises for the upper limb and lower limb joints, you have to do mobilization exercises, and you should take proper guidance from a physiotherapist how to do the exercises, and and perform them accordingly, like 10 times for each joint. For example, for upper limb joints 10 times, and lower limb joints 10 times. So this is how you have to go slowly and progress slowly in the exercise. And one more thing is, because of the medication and lack of proper dietary intake, you miss the vital vitamins and vital nutrients in the diet. So another way is supplementing the body with vitamin D3, magnesium, zinc, and acetyl carnitine, and coenzyme Q, like these supplements, so that they will fasten your recovery from the illness, and also you will win the war against COVID and easily overcome the muscle weakness, and go to your routine life as soon as possible. So for all the COVID patients, we wish you a fast recovery.